Thank you. Are we all ready? We've got one attendee, haven't we? So good evening, everyone. I'd like to welcome you to this evening's additional meeting of the Adults and Health Scrutiny Committee. So to practical matters, please may I remind you all to mute unless you're addressing an item, and raise your virtual hands should you wish to speak. I'll refer to Jane from governance if I need to record a vote or for any procedural matters. So moving first to apologies. Jane, do we have apologies? I'm going to hold my little sign up and say, Jane, you're on mute.
What are we going to do without that? Yes, Chair, we have received apologies from Mark Powell, Councillors Cross and Councillor Dale.
Thank you. Do we have any, number 2, declarations of interest? Do we have any declarations of interest from members? Not that I can see. Petitions, deputations and questions. Do we have any, Jane?
None received, Chair.
Thank you. Any questions with notice from members?
None received, Chair.
Thank you. And any any notices of motion from members, the bit I always forget?
None received, Chair.
Thank you. And then any consideration of a matter referred to the committee for a decision in relation to a call-in?
None received, Chair.
Thank you. I now would like to move to item 8 on the agenda, if I can. Sorry. Dr. Underwood's got her hand up, and possibly because I've skipped right past minutes, haven't I, Dr. Underwood?
It's not on my agenda, which is probably explains why.
Exactly, it's not on mine either on this one, and I do know that we do have. Are we?
If I can explain, Chair.
Of course.
The minutes from the last meeting weren't published until yesterday, and this agenda was published last week. So both sets of minutes will go to the next meeting.
Thank you. Could I bring Dr. Underwood in? We do have on those minutes that were published yesterday, there is just a slight amendment that Dr. Underwood would like to raise with that was on one of her actions, and it was just regarding item 8 on those agendas. Dr. Underwood, do you want to come in and state the amendment, and then if we can have that clarification done for the next set?
Thank you, Chair. As Councillor Harvey has said, it's pertinent to point 8, item 8, which was the update on the COVID support. At the very end, I agreed to email Mr. Morley but qualified my agreement by saying I couldn't break confidentiality rules by giving specific details. That's been omitted, that actual phrase that I said. It's really important that is added, because as it reads at the moment, I'm fearful that it could deter the public from approaching Health Watch Rutland if they're in difficulties, for fear that I might release their details or we might release their details. So I'd be really grateful if that could be changed as soon as possible. Thank you.
Thank you, Dr. Underwood. Thank you, Jane. If we could make that amendment. And then, as stated, we will just quickly move to item 8 before we come back to 7. So 8 was access to primary care for Rutland residents with regard to Lakeside. So on the 2nd of December 2021, the monitoring officer wrote to Lakeside Healthcare requiring a representative to attend the committee tonight to provide information and explanation in relation to the running of the practice. Members will recall that I, as chair, had invited the practice to attend our meeting on the 25th of November, but no response was received. The monitoring officer outlined the legislation which makes it clear that members and employees of a relevant NHS body or relevant health service provider have a legal duty to attend before a local authority when required by it, providing reasonable notice has been given, to answer questions the local authority believes are necessary to carry out its health scrutiny functions. The letter also outlined the information the committee required, namely that we wanted an update on the improvement plan, that we wanted comments on actions from the latest CQC re-inspection report, and also an explanation of the management structure, including head office. On the 6th of December, Monday evening, Terry White, the hub manager at Lakeside Healthcare, Stamford, informed the council that Lakeside would not be complying with the requirement to attend this committee. This is a serious matter which will continue to undermine public trust in the running of these essential public services. I've referred the matter to the CQC lead inspector and the CCG, and I also wish to move tonight that the committee resolve to make a formal complaint to the relevant authorities, setting out the failure of Lakeside GP practice to attend the meeting. I will be circulating the correspondence to form part of the records of this meeting. And I think the email from Lakeside speaks for itself when you read it. So I'd ask, do I have a seconder? Thank you, Councillor Waller. And if I could look to the rest of the committee for a vote, if you agree that we do the formal complaint. Thank you. Sorry, I couldn't see you, Councillor Ainsley. So Jane, that was unanimous, if you could. Thank you. We will add, I'm sure the rest of the committee will agree, we are deeply, deeply disappointed that they have decided that it's not fit, they're not fit to come here. So anyway, moving back on, we will go back to our substantive item then, which is the draft Rutland Health and Wellbeing Strategy. So it's a discussion regarding the draft Rutland Health and Wellbeing Strategy, which is currently open for consultation. I would welcome a frank and open discussion regarding the strategy. So do we, I'll come to you, John. I'm just looking for you. Sorry, there you are on my screen. Did you have anything you wanted to say moving in, or are you happy for us to start?
I'm more than happy to for you to start, Councillor Harvey. Everything that members say here tonight will be fed into the consultation, which is what this is about. We're very keen to have all member views, because obviously you have the views of your wards, and you'll see professionals from public health, from our own local authority and the CCG, all with eager ears, and if you have any questions specifically, we will certainly endeavour to answer. Thank you.
Thank you, John. So I shall open up to the committee. How I suggest, and we can decide, we'll go through the strategy, and then if we're minded at the end, hopefully we will do a formal written thing into the consultation, a formal response to the consultation that we will submit. So I'm happy if, who would like to start? Councillor Waller. So we'll go Councillor Waller, Councillor Power. It's very quiet then, you worried me for a second. Councillor Waller.
Thank you, Chairman. Early on in this document, it talks about it being an evidence-driven approach, but I would like to have seen more about what the evidence was, because there are a number of places in it where I'm wondering what evidence lay behind the statements that are made. I mean, I think it's absolutely right that it should be evidence-based, but for example, it talks at one point, and I've lost it again now, about the ethnic minorities' health outcomes being less good than other groups. Well, which particular ethnic minorities in Rutland? Because we don't have a huge number. And I wonder whether we're just talking about a dozen families. Well, we're then identifying them fairly specifically in this, which we shouldn't be doing. So that just doesn't, to me, make sense. And also, all the time, we're getting statements, but without any explanation. So in section 2.4, for example, where it's got the children, overview of health children. First of all, I'm not sure whether we're talking about Rutland residents or children in Rutland schools because of the way it's written. I interpreted it one way when we were talking about it earlier, and the chairman interpreted it in the absolute opposite way. So I don't think that's very helpful in the way it's written anyway. But why is it significantly worse for Rutland children at secondary level? What lies behind that? Or is it, in fact, that our children's services and health services are so good that we are identifying children that other places aren't identifying? Oh, and our schools, of course, because they contribute to that. We just don't know these things. And I would have liked to have seen some of that in the document. I'll stop there at that point. Thank you, because they were by way of illustration. Thank you, Chair.
Thank you, Councillor Waller. And I'll let Viv come in because I can see her hand up and I think she'll be coming in to answer that. And then hopefully, you can come back again, Councillor Waller, or we'll go to Councillor Powell. So Viv, would you like to answer?
Thank you, Chair. Yeah, thanks, Councillor Waller, for a really important point around an evidence base. And what I would just like to assure you is that although we haven't got the full evidence base within the strategy, there was a significant amount of work gone behind the scenes, and granted it's not in the strategy, and I think some of that was a discussion around making the strategy as accessible as possible, but that went into this. I think in terms of your specific points around the special educational needs in secondary schools, I think you're absolutely right that we don't necessarily understand why that is. And what we're doing is we're saying that there are key issues here that are highlighted from the data that we will then look to explore in a little bit more detail to understand what those reasons are and how we can tackle those issues, if they are issues, moving forward as part of the strategy. In terms of things like your population and your definitions, what I can certainly do is we can make sure that when we go through any of these, we add in some specific references. So that if people are interested, you can go back to that initial data source to absolutely understand where that is. So I can make sure that there's that clarification for you, and I'm more than happy to take that as a comment moving forward. Another thing that I just wanted to just point out around is I know there have been discussions around the Joint Strategic Needs Assessment, that will continue to be an important part of the strategy moving forward. We haven't got the formal document done for this strategy, and that is acknowledged. However, we have got plans that moving forward next year, we've got the whole of the census data coming out. So there will be an absolute wealth of new information that will be really, really up to date for Rutland, that we will be making sure that we get a full needs assessment done and as part of the Joint Strategic Needs Assessment, but also making sure that anything that comes out of that is reflective within the plan. So please do be reassured around that. And what we will try and do is bring a paper to the Health and Wellbeing Board in February around a sort of potential more up-to-date approach, I suppose, around the Joint Strategic Needs Assessment, so that we can make it more of a live document rather than one document that is great for the 6 months when it's written, but then becomes out of date quite quickly. So please be assured that a strong evidence base has been had. We can certainly do more around the references for you so as you can understand that data in a little bit more detail, and there will be more to come.
Can I come back on that, please?
Of course.
I'm not reassured. You could be telling me absolutely anything, Vivian. Now, I'm not trying to question your professionalism at all, don't get me wrong, but I'm here representing highly intelligent people in our community. We know, statistically speaking, that we have a very well-educated residency compared with some other places. And people say to me, well, where's your evidence? Is it true? All this about children, surely the real issue is all these people who are growing old. We've got a big aging population, but this document isn't focusing on that. Well, there is an element in it, of course, but what we don't know is, well, one of the reasons why perhaps we're not putting as much emphasis on the elderly, and that includes me because I'm over 60, is that we actually are aging quite well. And our health outcomes are really rather good compared with other parts of the country. And if I can't point people to that sort of information, then they're just, all they're saying is, this is just another document that somebody sat in a room somewhere and just sat and wrote, and oh, and doesn't it look like the document that we produced 4 years ago? And there are elements of children's that look very, very similar to the Children and Young People's Plan 2016. And there's no reference to what improvements there might have been over the last 5 years, or where we've been going backwards, what we might do to make things different. And if this is an opportunity for us to plan for Rutland, then it needs to reflect what has happened in Rutland and have clear aspirations of where we want to go forward in Rutland. And it needs to be written clearly. So I still don't know whether we're talking about children who live in Rutland or children who are educated in Rutland. And you didn't address that bit. So I want to see more, or at least be signposted to the data in the document so that I can find it if I want to find it and know more about it. Because there is a great deal of distrust out there with Rutland County Council at the moment for all sorts of reasons. And we as members are doing our best to try and overcome that. And we need documents that are going out in our names to be clear and that we can defend.
Thanks, Councillor Waller. Viv, do you want to come back?
Yeah, thank you, Chair. I think I can completely understand your concerns, and I think if you're feeling that the strength of evidence base isn't strong enough in there, then that is certainly something that we can take away and strengthen. That isn't a problem. I do want to reassure you that a significant amount of work has been done to generate the evidence base here. But if we need to demonstrate that further in the document, then that is certainly something we can take away and we can strengthen that. I think one thing that I would just like to say in terms of the specific indicator around the special educational needs in secondary schools is I'd like to go back to the data and specifically look at that for you, because I wouldn't want to tell you the wrong way. So if you're happy for me, I'll take that action away and I'll make sure you get a direct response exactly around what the denominator is on that, if that's okay.
Thanks very much. Councillor Powell.
Thank you, Chair. I would fully support what Councillor Waller has said on the data, and whilst you don't want to make this sort of document too heavy, it is really useful, I find, if things are actually referenced where the data comes from, and also to make sure it's the most up-to-date data. I'm sure it will be, but actually some of the dates in here look a bit old, and how relevant that is in the current climate. So I think old data can sometimes be not as, equally unuseful as much as not having, so some references would be useful. I just wanted to make a couple of sort of overall points. First of all, the strategy is 2022 to 25, 3 years, and I appreciate this is a high level document, but that to me seems quite short, and I wondered about the rationale for that. I would normally expect maybe a 5 year strategy. And the other point really is over the whole context. So we did discuss the priorities at our last meeting, and I don't think anybody would have any particular issues with the priority. Obviously, priority 6 has been added in, and there is no information or action on that at the moment, which sort of doesn't look very good when we're going out for consultation if it's just got a TBC on it. And really the overall point about, okay, we have the high level actions and there's a statement that it will be supported by an implementation plan. But I would have hoped at this stage, seen as we're, time is rapidly disappearing, that there would have been an operational, at least a timetable and some markers about how this would go down to the next level, because it would be the high level actions are quite vague. and it'll be the delivery plan that sits underneath that, which will be really important, especially in terms of costing up the resources, etc. But to some sort of schedule about when that will be produced, what the next steps are, responsibilities, I would have thought would have actually put this in the right sort of context.
Did you want to come back on that?
Yeah, more than happy to, and feel free for others on the panel to add what to say. I've written a little list, so I apologise, Councillor Powell, if I don't cover them all. So do pick me up if I don't. So in terms of the timescale, I think that's something that you know, if we get strong feedback that actually we want it to be a longer strategy, then that's certainly something that we can consider. I think we went for 3 years because the previous health and wellbeing strategies were 3 years. But if we feel that things have changed and moved on, then I don't think that has to be fixed. I think it's really important that we have a strategy that gives us long enough time to start implementing some really key actions, acknowledging that some of these actions are going to take much longer than 3 years. And we'll need to have really clear milestones in terms of what we can actually achieve between year 1, year 2 and year 3, and then potentially what actions we'll need to follow on in subsequent strategies. But as I say, if it comes back strongly from the consultation that it needs to be a longer strategy, we can certainly do that. The other thing that we will be doing as part of that, and it links into your question around the high level actions and implementation plan, is what we're consulting on at the moment is the overall vision and strategy and vision and priorities. We will then get a delivery plan developed for the February Health and Wellbeing Board. And as part of that delivery plan, we will have a much more focused and in detailed discussion around year 1. Because I do think we need to acknowledge that there are some things in the strategy where we need to do the work to understand the issue more before we can then actually come out and say, this is what we're going to do. So, for example, you picked up around priority 6, around really having a really positive end of life. One of the key actions around that will actually be about doing a sort of needs assessment or joint strategic needs assessment chapter around end of life, really understanding where we are in Rutland around end of life care and what good end of life looks like and what our population feels around end of life. Because some of the key things that we think are coming out in terms of priorities are really around supporting people to have the best end of life they can. But to see end of life as a positive part of their life course and how we can normalise that discussion and that journey for them and really make sure that they get the best quality. So I think it's about being aware that there will be some things that we will have much more meat on the bones for, and there will be other things that actually we know we've got to do more work on. And hopefully you will be reassured by some of that will be coming out with the February plan in there. And I think that hope, and then in priority 6, we've got much more work to do is the honest answer around that. Obviously that priority came out at the Health and Wellbeing Board when it went as a draft in October, and we have to consult on the draft that went to that board. So we've obviously just made small amendments now, but we will be very much listening to the consultation. We've got work groups set up around the priorities to really get into the detail around what those really specific delivery actions will be. And hopefully you'll feel reassured when that comes to the Health and Wellbeing Board in February. I hope that answers your questions, but if not, feel free for anybody else to chip in.
Councillor Powell, do you want to come back?
Can I just come back on the length of time? And I'm not saying 3 years is wrong, but you said you'll see what comes out of the consultation. Surely when we're setting a strategy, we're not, you know, the strategy has to fit with what is the right length of time for the strategy. I'm sorry, that's not something really I wouldn't suggest that depends on the consultation. I don't know many people will feedback on that, but surely that's for people who are looking at the evidence, looking at the bigger picture of what's going on in the wider world, actually decide that actually this is the best length of time for the strategy. So rather than thinking, oh, what have we done before? Or so I would like to suggest that actually the group actually reviews, is this the right length of time for the strategy? It's not subject to what people think on the consultation. It's got to fit in with Rutland's, you know, got to have links into the corporate plan as well to make sure we're linking these things up. So would say that as on the first point. And I think on the second point, it's more having the context. Okay, I appreciate there is more work to do, but it's more having the contents and the reassurance that actually that, you know, we have a project plan for doing this. It's not necessarily the detail around it, but actually there is a clear plan going forward of the stages, and to make sure again that fits in with wider issues, and to have some reassurance on that.
Sarah, you've just put your hand up. Do you want to come back on that point?
Yes, if you don't mind, Councillor. I just wanted to support Viv in saying that the group has effectively, if I'm right in saying, and Viv, correct me if I'm wrong, identified which is the lead organisation for each of the priorities, and each of those organisations are working hard to put a delivery plan together around each of those, with the February date for coming back to Health and Wellbeing Board. So I just wanted to, and from a health perspective, I think we've taken a couple of those delivery functions. So I just wanted again to give a bit, you know, a bit more of assurance and to support Viv in that work is ongoing at the moment. Thank you.
Thank you, Sarah. Viv, did you want to come back?
Yeah, thanks, Sarah. I think Sarah's covered a lot of my points there. I think it is just really worth highlighting that we have got really key leads around delivering the detail on those priority areas. We're really lucky to have Sandra really supporting and doing a lot of work around that for us, and we have got very specific workshops to make sure that we are really driving those priorities in a very collaborative and partnership way. And I think one of the things to sort of highlight around this is that this is quite a new approach. Actually, I don't think we've ever developed a health and wellbeing strategy in such a collaborative way. But that does add complexity to that, and sometimes that can add a little bit more detail and a little bit more time in some of that. But what I think it will really mean is that when we come to February, we will have a really good strategy and vision and plan for Rutland. So it's just, I suppose it's just asking you to bear with us a little bit until we can get that finer detail down for you and then provide you that assurance then.
Thank you. John, did you want to come in?
Yeah, just to comment on Councillor Powell's point of the linkage with the corporate plan. That is going to be happening, Councillor Powell. We've actually got meetings in our diaries, which I'm going to be part of, with Viv and Mark Andrews, to make sure that we link these two up, and you will see going forward outcomes. You'll see what looks good. This is very much a high level vision at the moment, and the plan as you're describing it is being put together by these groups, and it's that plan that will be shown at the Health and Wellbeing Board, and that's very much the timetable.
Thanks, John. Councillor Ainsley.
Thank you very much indeed, Councillor Harvey. I just, first of all, I'd like to say, I think at a very high level, I really think this is a very bold strategy, and I think it is going to be exceptionally difficult to try and pull together all the different agencies. And but I do want to demonstrate the points, or to reinforce the points that we made earlier about the data sources. I think that's particularly important, and I would urge you to actually at least give us a vision of where they've come from. And if some of it is confidential, then clearly that's something we may have to overcome. But if we're going to work together as a team, and that includes the residents, then I think data sources are absolutely imperative. And just a simple "you can find it here" list may be sufficient. The other thing I was going to say was that I agree with the second point made about the timescales. If this is a high-level visionary document, which I think is what it purports to be, and please correct me if I've got that wrong, then actually 3 years seems an inordinately short amount of time to actually have a vision. So we're going to have this vision and then poof, it's finished. And it would seem to me to extending the time would be beneficial. But I do realise the complexity. I mean, I'm not trying to make light of the work that you have to do or the work that's been done. And I look forward to the delivery plan in February. That would be exceptionally interesting, I think. The point I wanted to make was that that in the forward, it does actually say you can be involved people as stakeholders in their own care. How is that? What do you see in your head as the vision? How's that going to actually be achieved? Is it all going to be surveys? Are we going to be knocking on people's doors saying, how are you feeling, my love? I mean, how are we going to manage? Sorry, that was, but how are we going to, how do you see the management of corralling the stakeholders, that is the residents, into your progress and advance and actually tweaking the whole plan? Because a survey, in my book, a one-off, doesn't seem to be very comprehensive, and I wonder whether you've got a wider picture. So thank you.
I don't know whether that's Viv or John. Which would you like to come in? John?
Yeah, I mean, I utterly agree with that, Paul. We made this point at the Health and Wellbeing Board, that we need to get every voice behind this. So Health Watch is very much engaged. In fact, I've personally been invited to Health Watch, and I've just extended the invitation again to Viv and Sandra to address and to introduce this plan next week to the public. They are talking as our agents to various stakeholders. I've approached the consortium personally and have a meeting with them next week to get their input. I am particularly interested, and I keep banging on this about this to all partners around the table, and especially to Health Watch, to get the voices of the people who don't normally speak.
Yes.
So we don't always have specifics. Now, I've heard a couple of times that the vision is vague. I've also heard that the questions in the consultation are fairly vague. This was done on purpose because we don't want it so specific that we tie people down and stifle people's opinions. Not everybody's worried about tertiary care. You know, it affects very few people. And the people that even understand the concept are the ones that tend to speak out most. We're interested in the voices from the people at the estate that doesn't normally come out and talk, that has real problems. So this is very much our rationale, Paul. It's what we're trying to achieve. And I think it's vital that this document is seen as a dynamic, flexible piece of work that's got time. I don't want it a plan done and then signed off. As the data changes, as the JSNA changes, as circumstances changes, as the backdrop of the UHL reconfiguration changes, as the ICS starts to talk about cross-border issues and hopefully starts to knit that up. These are things that could take 3, 4, 5, even 10 years. All these things need to be in this plan. So we need to be flexible, dynamic, adapting to people's views and adapting to system changes.
Could I come back on that, if I may, please? I fully support what you're saying, John, but a couple of points I wanted to make was that actually a vision is just that. It's a vision, and that won't necessarily be changed on a regular basis. But the implementation, the plan, clearly has to be flexible, and that is something that is going to be a living, breathing document. At least I hope so. But hopefully, the vision will remain pretty static in that we're saying we want to give you the best chance of a long, healthy life, etc., etc. And those vision statements are really important. And please don't accept this as a criticism, at least not too heavily. As you're probably well aware, not you, John, but well aware that we are actively engaged in our own GP practice survey at the moment. And I was looking at the Health Watch, and you mentioned those as being your consultees. And I know it's difficult to reach, hard to reach people, but I was disappointed to see that actually I think it was 27 respondents or 29 respondents in that survey. So, but that's not aimed, that's not supposed to be a criticism, but it's probably taken as one. It's really saying that it's so difficult to get the hard to reach, and we have to be very innovative in the way in which we approach that. So thank you very much.
Thanks, Councillor Ainsley. Vivian, did you want to come back
Yeah, if you don't mind, just to support some of the comments that that John's mentioned, really. So I think you're absolutely right that engagement is an absolutely critical theme around the consultation, but also throughout the whole of the life course of the strategy. And one of the things that we will be doing is looking at a range of engagement and consultation and arenas where we can really genuinely engage with the local population to really shape and support service delivery and design. Now, we've obviously got an overarching consultation around high level priorities, as you've mentioned, but as we work starting through that, some of that detail and that implementation plan, there will be specifics that come out. So it may be, specifics to do with the UHL reconfiguration. It may be specifics to do with what we're going to do with end of life care. And that's when we will go out and really work with Health Watch colleagues, but also the wider population around, is there anything we can do around co-production here? And really working collectively and collaboratively with the local population to make sure that, how those services are developed and designed really works for them. So there's something for me around how we will do as much as we possibly can around that co-production agenda. And I know that's a really strong agenda for the NHS as well as for local authority and voluntary sector. But then there's also something for me around what we do with the health and wellbeing board, and how we reach out and really promote the health and wellbeing board to really connect with the Rutland population in a little bit more ways than it has done previously. So it's just really to assure you around that sort of work as well. So there's that sort of work around the board development, as well as the work of the actual strategy and the implementation that will be moving forward. So hopefully there will be a range of opportunities that we can really hear that local voice a lot more strongly moving forward.
Thank you.
Thank you. Councillor Waller.
Thank you very much, Chairman. I think if you are genuinely wanting to reach out to the general population, then you need to think about the way you speak to us or write to us. You are very keen, health particularly, and local government to a slightly lesser degree, but it is very slightly lesser, in using jargon, in assuming we know what you're talking about. For example, and this is the know what you're talking about, in the general blurby bit at the beginning on priority 6, which I think we would all support as a priority, by the way, dying well is a good thing. But in the second paragraph, it says, where we are now and what do we want to achieve? Rutland currently performs significantly higher than England for the percentage of deaths that occur in care homes, and significantly lower than England for the percentage of deaths occurring in hospital and in a hospice. Rutland currently has a great big lump of water in the middle of it, known as Rutland Water. But what does that tell you anything about dying well? You're not saying, and we know from research that people who die in hospital, their relatives tell us that it is a painful experience, or equally, we know that people who die in care homes, their relatives tell us it was a good experience. You're not explaining why you're putting it in there. And what about the people who die in their own homes? Is that good, bad, or indifferent? And they're not mentioned at all. And so think about it from the point of view of somebody who is not an expert in your field or in public service. I mean, many decades ago, young civil servants were made to read a book called Fowler's Modern English Usage, at least I think that's the title. It's words to that effect anyway. And it was to stop them using jargon and to get them to write in plain English. But I'm going further than that. I'm talking about not plain English, because it's perfectly plain. Anyone would understand the words. But why? Why are you saying it? What is the point? And you need to be thinking that as well. Everything that you write has to be written for a reason. And that's part of what lies behind my initial comments about the lack of data to substantiate this. You need to say what you know, why you know it, where it comes from, and what it means. What is the value of that knowledge? because we can all be data rich and information poor. And we need to demonstrate, and you need to demonstrate, that actually this is information, and the information will then determine the strategy, because then you can say, and actually we don't want people to die in care homes, or we don't want so many to die in care homes, and we're going to try and move from 80% to 70% or whatever it might be. And that's the strategic aim that you are going for. And then the general population can say to you, we don't agree. We think you should go for 60%, in my rather silly example there of percentages. But do you see where I'm coming from on this? So I think there's a lot more work to be done, really. And people will engage if you're giving them something worthwhile to engage with. Thank you.
Thank you, Councillor Waller. Viv, do you want to come back on that?
Thank you, Chair. Yeah, I mean, I think we can always improve in terms of language and jargon, and we can certainly take those comments on board and really think around how we can make it more engaging and more connecting. And with that, that's not a problem. I think we do need to be aware that we might need to consider whether we need a more meaty technical document, and then more of a document that actually meets the needs of our local residents in a much more easy read format. And I know we have got easy read formats and things like that available as part of consultation, and we've got avenues to support people around that. But I think we can think around how we can emphasize that a little bit more. And then your point around translating the data into intelligence, we can obviously strengthen that as well in terms of how we're writing that in. So, you know, valid points, we can certainly take them on board, and we can see how we can strengthen those in the final version.
Thank you. Councillor Powell.
Thank you. Yeah, just a couple of sort of points building on that. One is, I was going to say, which I think Councillor Waller has covered it, you know, being about outcomes, what we're trying to achieve, which is in here. And I say I don't have a problem with the high level vision. And how will we know that we've actually made a difference on those outcomes? And I'm hoping that is going to be in the delivery plan. And my other question was, at what point does this link in to the resources, money, budget, whatever, that's required to actually deliver that? Is that something we'll see in the delivery plan, in terms of, you know, being in a position that we're very clear on what funding, assets, etc. might be required to deliver this? And so Rutland is a good position to put its case forward for those resources if we, or, you know, if we need to. So at what point in the process will that be identified? Thank you.
Thank you. I think, Viv, are you coming back on that one?
I can do, and then feel free for John and Sarah to add anything else that they want to. So I think being completely open and honest around the resources element of that, if pick that up first, there's no specific new money attached specifically to the plan. What this strategy and plan is doing is around really thinking around how health and well-being and care all come together with the resources that we've got, which actually, if you bring them together collectively, is a substantial amount of money to really make sure that we have the most high quality, effective and efficient services for Rutland. So some of that will mean that we will need to think around where we are investing now and where we need to invest in the future. Some of that will mean delivering things slightly differently. Some of that will mean making difficult decisions, and some of that will mean investing in new areas. And some of that detail will be worked through as part of the delivery plan. So just so that you're clear on expectations, it's not that I will be able to say, you know, this level of the delivery plan is going to have X million towards it or X thousand towards it. It's about saying that we are going to use the resources that we have across Rutland as a place in the most effective way possible. Now, there may be that we there may be that future sources come up and we can utilise some of those. So we know that There is significant amounts of money going in for the Step Up to Great Mental Health programme. Some of that will be allocated to Rutland as a place, but we can't define what that is yet. There may be money associated with PCN development, as there have been over the previous years, but Sarah will know more around that. But again, we can't say you're going to get a specific amount for this and a specific amount is going to be for this plan, because it's just part of the wider patch. So I think, and the other area is that I think that we're really aware of, particularly for Rutland, is that we know that there are circumstances that come up where sometimes you get very short deadlines for additional funding. And what we want to do is make sure that we're ready for those, so that if those opportunities come, we can get the business cases in straight away. So the honest answer is that we won't be able to define it, and probably the level of detail that you would like. And it is about working with the resources that we've got to get even better outcomes than what we have moving forward. So that's probably as much as I don't know whether John or Sarah want to add anything on that one.
John, do you want to come in?
Yeah, I can't. I mean, Viv has covered that off lovely as far as I'm concerned. I think where we are now, in that we haven't had any extra money allocated to such. I mean, we've had the BCF and what have you. It's very much how we cut our cloth differently going forward. And I think the appetite that we have in Rutland to do things different until we have extra resources should enable us to do that. I can't really add anything else. Sarah, I see your hands up.
Thank you, if you don't mind. So I would agree with Viv and John, but I think there may be some things, particularly in the stuff that we're leading on, that there may be some sources of funding that we might be able to bring in, but it would be difficult to identify those at the beginning. I think part of the action plan is to develop a plan and develop the financial plan that sits within it. So I think it might be a bit of a mixture. There might be some that we identify and others that we need to take a bit longer time in identifying the resources or utilisation of existing resources in a different way.
Thanks, Sarah. Councillor Ainsley, did you want to come in?
Yes, I do. Thank you very much indeed. Yeah, I just wanted to pick up on Vivian's earlier point about documentation, and I think there's been several comments about it. I would be very surprised if you're able to produce a document that satisfies all audiences. And certainly in my experience, I have always tended to go, and this may sound condescending, having user focused. So that would be, this is how answering the residents' concerns, and then perhaps a more technical supporting reference, and that would include all the references for the data sources and things. And then actually, I think separating the documents may be something that you wish to consider, and it's certainly be something that I would be considering, because of the vastly different audiences and audiences' expectations. And also, I would actually, and this is just a mute point, I would separate a delivery plan from an action plan. An action plan, in my book, is something that allows us to implement a delivery plan. So I know this is all very trite, but it's the way we used to work when I was doing my consulting stuff. And I just feel that actually, as long as you've given that due consideration, that may find that useful. Okay, thank you.
Thank you, Councillor Ainsley. Before anyone else jumps in, I've got a couple of points myself. One thing under, and I'm not 100% sure, it would sit in priority 1, enabling the best start in life. I noticed in 1.2, we talk about dental checkups. And then when we go back to in the blurb, we talk about children. Sorry, I've lost my page right now. I lost this earlier and couldn't find it for looking. What we don't mention anywhere in this document, and I think we do need to pick it up, is that, as we know from joint health scrutiny last time, that under 5s dental is a massive problem in Rutland, and it's an ongoing issue that we don't seem to have bottomed off. Now, there was lots of discussion on this in joint health scrutiny, and both Councillor Waller and I are waiting for some statistics to come back and some data to come back on it. What it doesn't appear to be is down to rurality, because actually the largest, and it is 40% of our 0 to 5s, have dental decay, are actually in Oakham. So it does not appear to be related to rurality within our villages and things. And my concern is that, again, we're not addressing that in here. And I do think if we're talking about the best start in life, then that is something that we need to put front and center. And actually, I do know, because it was stated within the at joint scrutiny, that would be dental is coming into the ICS and will be part of the place plan. So I do feel that that is something that we need to bring in, and as an authority, we need to say, we need to do something. I don't know whether Vivian wants to come, and I can see Rachna wants to come in as well. So Vivian, would you like to come, and then Rachna?
Thank you, Chair. So I know there's historically been quite a lot of discussion around dental for children. I think the reason why it's probably not come out strongly is certainly in the latest data when we saw this, I don't think it was as strong a theme as it had previously been, but I will certainly double check on the data to see where we're at now. And what we can certainly do is we're going to have a workshop around Best Start for Life. So we can make sure that it's come up as a strong theme there, and make sure if there's anything else that we need to add, we can certainly add it in there. That was sort of the key thing for me, so I'll hand over to Rachna if that's okay.
Thank you. Rachna, did you want to come in?
Thank you, Chair. Viv made my point. So as we said, we're looking to have this workshop, and absolutely the Best Start to Life includes dental care, and it will do, as all of the data supports that. But also it's what a lot of our people are telling us. So when we've looked at some of the Health Watch reports, and when we've talked to schools in particular, that's been a clear issue which people think that we haven't addressed in the way that we need to across the entirety of the patch. So we will include that as part and parcel of this.
Thank you. Councillor Waller.
Thank you. I was just, no, not just. I do want to endorse everything that the chairman has just said about dental. It wasn't that long ago that we had the joint health scrutiny, and we were told that the data we were given there was up to date, and Rutland's dental health amongst children was noticeably poor, even when you took the likes of Leicester into account, where you might expect, because of the deprivation levels, that they would be a lot worse. And they were in pockets, clearly, but ours was embarrassingly poor for what is, let's face it, an affluent area. So I also would like to see in priority 1 something specific about dental. In the table generally, which is the other reason I put my hand up, under priority 2, 2.1, the second, under the high level actions, the second star, that bit, it refers to faith sector. What do you mean by that?
Page 15, if you're struggling to see, it's page 15 of our pack. 2.1, second bullet point. It says further strengthening of collaborative relationships across the voluntary community and faith sector, also working with wider services, ensuring people can easily access the most relevant support for them. Sandra.
Thank you very much. Thank you very much, Chair. So the pandemic was interesting because actually this was, we found there was really strong working with Rutland's churches in terms of their impact and role working with vulnerable people. And I think it's a really valuable asset of our county, and something that I think we'd like to continue into what the future looks like in terms of health and well-being. It's you know, that the churches are key in whatever flavour and colour people believe is a key institution, and it's right there at the grassroots in our communities.
Well, if that's what you mean, then that's what you need to say. Faith sector has a particular connotation. What you actually mean is working with faith groups, which is something completely different. So can we get the terminology right, please, on that one? Chairman, may I go on the table, because I've got a few on the table that I'd like to raise.
You can, and then I'll come in because I've still got a couple of more of mine that I was going to say. But yes, go on. I will. If you go on.
Thank you. On the table, then, carrying on through it, and I can't use page references because I don't have any page numbers on my version. 3.2, again, high-level actions. First bullet, use so there is one health and well-being coach. Who is this person and who do they work for, and how would you find them?
Sorry, Sandra, I think we're coming back to you.
That's all right. So the health and wellbeing coach is a role, a fairly new role in our PCN, who is working with people who would benefit from support in terms of how they manage living with health challenges. There are also 2 further workers who are working in the RISE team, undertaking similar work. So there's very much an integrated cross organizational approach to that activity.
Okay, thank you.
Sorry.
And also on the same section, no, I know the answer. On the same section, the last sentence says key groups could include people on low incomes and those less able to travel. This is about preventative offers. They could equally include people who are working full time and the preventative offer doesn't fit in with their working practices. So can we avoid coulds, please? This sentence, it makes perfect sense. The bullet point makes perfect sense if you leave out the key groups could include, because I'd rather it be will include, and clearly we're not at the stage to know which groups that is yet. But don't conjecture on something that I would argue it's something completely different. You know, until we know, leave it out. But the point of targeting those who don't take it up is a perfectly valid point in its own right. Thank you.
Any others, Councillor Waller?
Yeah, it's the same point actually, but in a different section. It's 3.4, same area. In the second bullet point, we say work to ensure appropriate access to health services for military personnel, their families who face distinctive circumstances, and may be using pathways into planned care which are less well established than for civilian population. Well, it may be, it may not be. Don't say it until we know for sure. And we do know that military personnel do get healthcare within the military. Their families clearly do not. They are accessing civilian healthcare. I think some of the problem about the access is the transient nature of the military population. You know, they have what, 2-year term of duty and then they move on. And we don't mention that anywhere. And I think that's, well, from my experience of having a base in my ward, that actually is more of a problem than the fact that they are related to the military. It's the fact that they're here, they take ages finding out where the GP is or where this is or where that is. And then by the time they get seen, if they need to have some medium to long-term care, they've moved on before it's happened. So that is an issue that isn't addressed in this section.
Viv, would you like to come back on that? And I don't know whether one of our health colleagues can let us know, because I don't know where this was talked. It's in my head somewhere. Am I right in thinking that as part of the Armed Forces Covenant, or is it still in the ethos? But wasn't there a thing that said that if someone had waited in a different area, that waiting time is taken into account in our area, so they don't wait? Am I right in thinking that happens?
Yeah.
So Sarah, do you want? Yeah,
that's
Sarah,
part of the Armed Forces Covenant. Yeah.
Right.
Yeah.
So
the other thing, as an ICS, we've adopted the Armed Forces Covenant, So that's important to say. And there are some rights under that, like the one you've just articulated, Councillor. The other thing I'd say is we are going to do a piece of work that's actually come out of preparing the draft health and wellbeing strategy to look at in more detail over the next few months around military personnel and veterans' healthcare needs across LLR. So we are going to do that extra piece of work. I'm not sure whether it forms part of the delivery plan, Viv, or whether it's a separate piece of work, but I know my team has started to do some work on it.
Thank you, Viv.
And you are quite right, Councillor Waller, that is a big issue about people moving around, but there is a national part of the covenant, as I said, is that they shouldn't lose their place on the waiting list. They should transfer to their new trust at the same place on the waiting list.
Thank you. I appreciate that. I'm coming back, sorry, Chairman. I appreciate that, but the people themselves aren't necessarily aware of that and aren't necessarily pushy enough to make sure it happens. So I still think that transience is an issue. And actually, I'm not even sure that the action area should be to improve access to services, but it should be ensuring good access to, which is actually something slightly different. Because if we're seeking to improve, then we're saying it's bad now. And in some cases, it probably is. In some cases, it's probably not. But I think ensuring good access across the piece would be a better heading. Sorry, that was just a little extra that I've thrown in there. Thank you, Chairman.
Vivian, did you want to come back on that, or was that did Sarah finish everything?
And Sarah covered a lot of my points. So one of the points I was going to say was about this work that I know people in Sarah's team and from a public health point of view, we're going to support a bit more around military and veteran piece of work. And I suppose just picking up on Councillor Waller's point about access, for me, there's something around really doing that communication piece of work and linking with the RIS and to the Rutland Information Service around how people can get really quick and easy access to understand what services are available, and we can do that within the Rutland Information Service, but also then working with the PCN, because we've got a real advantage there with having one PCN covering Rutland. So we can certainly make sure we strengthen that within that, and there will definitely be some specific actions around the military personnel and doing a bit of more work and to understand the real needs from a health inequalities point of view. So we've got a health inequalities priority, and one of the pieces of work that I want to do fairly soon into the new year is starting to do a bit of a needs assessment around really identifying what those inequalities are for Rutland, and then really understanding where they are and then how we can link that work further into the delivery plan moving forward.
Thank you. So just go back. I'll go on to a couple of more points that I had. And one's kind of quite fundamental, really, that so I always refer to this as the place-based plan. And but I'm also aware it's also the Rutland Health and Wellbeing Strategy. So in effect, it's merging two documents into one, which has been quite confusing in a way to get our heads around, especially when we're looking at the ICS, which is such a massive fundamental change in the way the NHS services are run, and then at the same time sliding in our local health and wellbeing strategy. And in some areas they've got a separate strategy and a place-based plan. And so what I'm about to say is because of the merge of those two documents, I think that we've got, obviously the ICS is the new thing and it's coming in April, and this forms part of that place-based plan. And we do talk about the wider system context, but what I don't think that is explained very well in this document is where it all sits together. So where that system level is, where that place level is, and this is the place-based plan, but other than mentioning neighbourhood, it doesn't tell us where neighbourhood comes into it and where the PCN comes into it, and as neighbourhood, and what they're responsible for, what the place, what sits around place, what sits around system. So even if we had to add a page, I feel that there might be some use in that to kind of set where the document sits within the system, because it's such a complex thing, even for us to get our heads around, that we're then expecting a resident to get their head around and understand what this means to them. It's very complex, especially in these early days of everything. And then the other thing does speak to somewhat to what Councillor Wallace says. And I wonder whether it's worth, so some of the, there's a lot of kind of acronyms, our favourite in here, and things that we know what they are, but actually, again, people don't. I wonder whether it would be really useful to have a glossary at the back that explains. So, RISE team. What is our RISE team? Now, we know because we come here and you tell us, but again, our average Rutland resident may not understand who our RISE team are. So actually, I think it would be really useful to have a glossary of all these terms, who the health and wellbeing coach are, where they sit, so that we could have a quick sit, and actually it would maybe help to stop framing this all much better for people to actually read and understand. So that would be a couple of points I thought. And then coming back to the fact it's our place-based plan, and John won't be surprised for me to say this, the governance of the place-based plan is not mentioned in this document. And certainly it does talk about the Health and Wellbeing Board, but actually I think some of how the governance of it looks and who reports to who, and Scrutiny sitting within the place-based plan, there is a specific thing where Scrutiny sits within this place-based plan and where Scrutiny feeds into it. I think that does need to be put into our plan and written into our plan. I don't know whether John wants to come back on any of those points.
I tend to agree, Councillor Harvey, actually. I think we do need to set a context, I think is probably the word, perhaps as an introduction as to where place fits into a system, because there are various plans and what have you, as we were alluding to earlier indeed. And perhaps a diagram, a very simple diagram, you know, with the various boards, the system boards that are springing up, where the Health and Wellbeing Board sits there. That's certainly something I think that we can look into, and will certainly make it easier for people to understand.
Thank you, John. I don't know, I'm looking to the rest of the committee. I don't know whether anyone else has got. They've all gone very quiet on us. Oh, Dr. Underwood.
Thank you, Chair. It's been really interesting to listen to different people's points of view, etc. I just want to make a couple of comments, stroke suggestions. The first one, well, they're both really about engaging the public. The first one is, has there been any thought into actually asking health and social care professionals in Rutland, that people that are working in Rutland, what they think? I can see some nods. And my second point is really picking up on Councillor Ainsley's point about only 27 people having got involved with our GP survey. Well, it wasn't a survey, it was qualitative research. First of all, because it was qualitative research, that by itself lends to a much smaller population involved in the project. The reason that we went for qualitative research for that particular project is because we have found there's a weariness with surveys in the county. It's been difficult to get people involved in filling in a survey. You've got to have a reasonable number to be able to show some sort of statistical significance. So we thought we'd try the qualitative approach, but even then we have not found many people volunteering to come forwards. Some of the difficulty we think has been because a lot of engagement has had to be done remotely and the people don't Not everybody uses a computer. Not everybody wants to talk on a computer. We have done some face-to-face engagement, and we have done that in sort of well-ventilated areas or gardens, but that won't lend itself very easily to this engagement that you're planning over the winter months. And then another point that we've noticed, and I think should be taken on board, is that when actually trying to recruit these surveys and the qualitative research, we get probably twice as many women as men, and the much older age groups than the younger age groups. So really my message is, can you try and encourage men to fill in all your comms, etc., and can you encourage the younger age groups as well to fill in? Healthwatch isn't actually running this engagement. The council are doing it, but they're my tips for what it's worth, and the experiences that we've had over the last year or so in trying to recruit people. Thank you.
Vivian, I'm sorry, I didn't see you put their hand up first. So was it Vivian? Would you like to come back?
Yeah, thank you, Chair. So thanks, Janet, for the useful tips. So I can make sure that that's fed back into the Rutland team around the younger and the male population. Because we do acknowledge that with any survey, you do get a bias around who responds and who doesn't. And I think that's why we are looking at how we can utilise as many different angles as possible through the consultation, but also through the longer term implementation of the strategy, so we keep that conversation going. So although we've got a defined period around, the consultation for, the initial vision and strategy, we do want to keep that conversation moving and that engagement with the board, as I mentioned before. In terms of the engagement with the wider workforce, just to sort of reassure you, there's sort of two elements, I suppose, of the consultation. There's the side that's really focusing on really getting that engagement with our local communities and our local population. And then there's a side that's really engaging with our local workforce in terms of what do they genuinely think. And when we mentioned the workshops earlier, they will be going out far and wide to see if we can get as many people as possible to support the development of the delivery plan, because there's something about people developing them and then owning them, because actually they're going to be absolutely key assets in the delivery of this plan. So we really want to bring them with the journey and make sure it is a truly collaborative approach. So there is the workshops, but then there are also a range of more formal meetings that we will be going to, and we are also spreading the comms far and wide through our different organisational routes as well. So just to reassure you that there's a whole work stream around that as well.
Thank you. Sandra, did you want to come back?
Thank you, Chair. I just was going to say we got our first summary today of the consultation demographics, so we can see roughly the population that's coming through. And Janet, it won't surprise you to know that you're on the money in terms of who has responded so far. So this is going to help us in terms of targeting our next phase of publicity. The other thing that we have is a clear graph of when people are filling in the survey, so we can see which of our modes of comms to get the message out is actually more successful. So I won't tell you that we have all the answers. We don't at the moment, but I think it's really important that we take a humble approach, which says actually that we need to learn as we go along about who is engaging and how, and think about how we actually reach populations who might not be coming forward. So, for example, I think there's an opportunity also, for example, to talk to schools and raise awareness there. To get young people coming through. I mean, we know the importance of mental health issues, for example, for younger people. I would love to be hearing that voice. I think we need to be hearing those voices.
Thank you.
Can I come back on that, please, Chair?
Of course.
That's really reassuring from both of you. Thank you for that. Can I suggest that you contact, I'm talking about the experience I had when we were looking at what people wanted from place-based care, and probably the most powerful meeting we had was with the parents of children with learning disabilities. they really were very passionate about the situation they were in. And I think they would welcome being able to give voice to that to the local authority if possible. I don't know, I'm just surmising, but it was such a powerful meeting.
Sandra.
I just wanted to add really that we're in a very tight, thank you, Chair, that we're in a, and Janet for that addition. I think we're in a very tight timescale at the moment, and we've got Christmas in the middle of it. And this is all very regrettable, because actually what we really want to do is have a longer term, deeper conversation with people where they can keep coming back to us. And, you know, as we make progress, we can refine the message, get deeper, understand, build trust. And it's such a shame that, you know, we're kind of boxed into exercises that have end dates on them. So I think there is a challenge for the Health and Wellbeing Board in thinking a bit broader about how we work on relationships rather than this sort of smash and grab approach to consultation, which is sort of, I mean, it's mandated by our current train tracks that we're on. But wouldn't it be exciting if we could actually break away from that as we develop forward?
I think that sounds absolutely fantastic. I hope you can get the impetus from the local population. It's so important that they're heard. Thank you, Sandra.
Thank you. So do we have, looking back to the panel, do we have any other comments that we want to bring forward? No, I'm not, they're not even looking at me at the moment. Shake heads, no. There's a shake there's a shake. So what would, don't all rush at once to speak, panel, but what would you like to, where would we like to go from here? So we've had a discussion this evening. Councillor Waller's put a hand up. Councillor Waller.
This meeting has been recorded, and Jane is obviously making notes and will be writing minutes out. Our colleagues around the room from Health and Social Care have all also been making notes for their own purposes. I saw quite a bit of scribbling going on, and I'm wondering whether we simply trust the systems to have listened to us and take on board, or not, as the case may be, rather than try and formulate something that is not going to encapsulate everything anyway. You know, we had a really good opportunity for all of us to have our say on this and to listen to the responses to our questions. And I hate, this isn't my normal way of doing things, but I do wonder whether we should just leave it at that tonight. Just a thought for everyone.
I thought that's putting all the pressure on Jane. For the minutes I'm recording. John, I will just ask you, John, do we think we'd be happy with that? And I would also look to Councillor Wilby as our Health and Wellbeing Board member. Would the Health and Wellbeing Board be happy to accept that as the kind of our consultation kind of submission?
That to me first, Chair.
Yes.
Okay, so yes, I would welcome that. The reason I would welcome that is that I have a tremendous amount of confidence in my colleagues and staff around the table here. I think Sandra's point was a powerful one in building relationships, and we need time to build those relationships. So time is very much a factor here. So yes, I would welcome that. And again, there's not really a great deal that I can add. I thank you for your comments. I really do. They will be added in. They're extremely useful because we get an insight from yourselves that we often don't get. that we don't have as professionals, and often the public themselves don't give us. So that's welcome. I hope that goes to answer your question, Councillor Harvey. But yes, I like that idea.
Thank you, John. Councillor Wilby.
Yeah, thank you very much, Chair. Well, I've sat and listened to all the discussion with great interest. I'm a new member of the Health and Wellbeing Board, but I have been floating around the health issues for quite some time, and I have to say that I agree with the call to make sure that there is always an organigram at the start of any of these things, so we know exactly who's doing what to who and when, because it is very difficult. And Sam's point about acronyms, a glossary, and also whenever you use a term for the first time, use the service way of writing as put it in full with the acronym after it as well. But what I have seen over the last month, Vivian gave a very good presentation last week, I think, or maybe the week before. I seem to have been watching so many VT screens of late. And I know there is a great deal of enthusiasm there, and I know there is a great deal of expertise. And I wouldn't wish you to lose any of that, because we, and Councillor Waller is very right, it's Ernest Gowers you were thinking about in plain language, by the way. Ernest Gowers, and there is often, we use too many words when we could just cut out a couple and come down the tube. And we need to be simple in everything, particularly in medical things, I think, and anything to do with local government, because it is difficult to pinpoint the right pathway and find your way through there. So I think it's important that we listen to everyone, chamfer up the ideals, because you're absolutely right. When you're looking at the overview document, it's one which should last for a long time, to be honest. The vision is something that we always want to have, but what we've got to do is to be able to be flexible and dynamic and change the way in which we get there. I mean, who would have known 2 years ago that we were going to have a pandemic? One of the things that I don't hear coming out enough is resilience. We've got to make sure that we can do the work despite having, certain avenues chopped off. So I think it was a good discussion tonight. There were lots of strong opinions given. I think we have to try and put a soft pedal on some of the opinions so that folks don't totally get despondent. But I think if we take note of all the things that have been coming out and just do a little bit of manipulation on the way we're doing things, then we're striving in the right direction. And we all know that consultation is quite difficult for all the reasons that have been said today, but timelines certainly I don't think should be set in stone. And if it looks as though by delaying a little while we're going to get a better answer, then within reason we should do that, as long as it's not stopping a crisis coming over the hill. So just because there is a timeline established, let's make sure that there is a good reason for that timeline. And if it needs extending to get a better answer, then perhaps that's what we should do. But thank you for letting me listen in.
Thank you. Councillor Waller.
I'm being pedantic. When I referred to Fowler's modern English usage, I did actually mean Fowler's modern English usage, and I've just looked it up, and it is available in obviously not the original, on Amazon, as most of these things are. And the chap who wrote it was called Fowler, the original one, but we are going back to the 1950s, I think, when it was written.
Ernest Gowers is already very, very important in making English simple.
I'm not disputing that, David, and that is he indeed has written books. But when I referred to Fowler, I meant Fowler, and that was what civil service had to use back in the day, before my time, by the way. I was still a student. When I wasn't even a student, I was in sixth form when Fowler was going out of usage. As I say, I was just being pedantic.
I didn't. That's not like you, Councillor Waller. I was going to, I didn't know, and I was listening to our whole debate. There was a couple of key points that I quite liked, and I wonder whether as a committee we wanted to maybe go a little further and do recommendations for them. The first one was something yourself, Councillor Powell, and Councillor Waller brought up, and that was regarding the timelines of this and the fact that this is a strategy that goes from 22 to 25, and we know with strategies that we'll then be looking at redeveloping it probably in 23, so we'll be revisiting it to reopen it. And so I was thinking, might we look at sending a recommendation to the Health and Wellbeing Board, taking on board comments Vivian made around the JSNA and the census data and how important that will be at feeding into this, that actually should we think as a scrutiny committee of bringing forward a recommendation that when this is revisited in 23, that it be prepared as a 5-year plan and not just a 3-year plan or 5-year or more plan, and so to give slightly more length on it. So I would look to the committee to see what they think on that, and I'm sure Councillor Waller is coming straight in. But before she answers that, there was one other point, and it won't surprise people to hear me say this, that I totally agree with what Sandra said around participation, and actually an ongoing consultation strategy developed by the Health and Wellbeing Board, because it is a key, it's our key instrument for getting the voice of our residents into our health. And so I would recommend, everyone will be laughing at this recommendation in a moment with what I'll say at the end of the meeting, but the recommendation that the Health and Wellbeing Board actually develop a participation strategy for itself, so that it actively develops a strategy in how the Health and Wellbeing Board itself will will communicate and will consult long term. So actually that's a key bit of stuff that the Health and Wellbeing Board doesn't currently, I think, have written in its terms of reference or in its thing, and actually, as Sandra said, is essential, and especially essential being as the Health and Wellbeing Board, it's such an integral part of this new place-based plan. So I think that because that could then be written into this. So I'd look to Councillor Waller to come in, and I would look to, obviously everybody can tweak the wording, but I would look to see whether the rest of the committee support those 2 recommendations. Councillor Waller, over to you.
The latter one, that we asked the Health and Wellbeing Board to look at developing an engagement strategy, I think I would support. The former one, I think I would want to request the Health and Wellbeing Board to review the timeline of the current strategy. We're not telling them to make it 5-year, but we are asking them to consider that.
Okay.
I'd rather see it that way around.
Are you happy with that wording? So looking at Councillor Powell and Councillor Ainsley, sorry, you vanished on my screen, and Councillor Fox, are you happy with those 2? Do you want me to read out the wording? Councillor Powell, do you want to come in?
Yeah, I'm quite happy with those 2 recommendations as amended by Councillor Waller. Just review the timeline and and recommend about the participation. I'd support that.
So Jane, the wording of the 2 recommendations that we'd make would be that we'd ask the Health and Wellbeing Board to review the timeline of the strategy. And then number 2, that the Health and Wellbeing Board develops an engagement strategy as part of an ongoing consultation with residents. So if I propose those 2 recommendations, do I have a seconder? Sorry, was that you, Councillor Powell? I didn't see hands.
Chairman, June's got her hand up, but I don't know.
Oh,
whether
sorry,
to speak
sorry,
or-
June. I didn't see you. Sorry. Do you want to come in?
Okay, I should have put my electronic hand up, but yes, I would second the motion of both proposals.
Oh, thank you. So all those in favour? Thank you. I think that was unanimous.
That's a
Jane.
unanimous, Chair.
Thank you very much indeed. So that closes this section. I'll shuffle my bits about. Bear with me. We've got so firstly, if it's okay, we've got the last bit is our review of the forward plan and annual work plan, but I'm not sure that we need all our officers and our colleagues from health for this. So if they wanted to and had other things that they might like to do of their evening, we would bid you farewell and good night, and thank you so much for attending tonight. It was fantastic to see you.
Thank you. Good evening.
Thank you.
So we will move on to agenda item 9, which is our annual work plan, which we've discussed. No, we haven't discussed in our pre-meeting, have we? So we didn't. I don't think we've made any amendments to it. I'd look to Councillor Waller. I don't think we, as vice, did we? We haven't made any amendments since our last meeting, which was only a fortnight ago, wasn't it? So there isn't anything further. Jane, have you got anything?
We haven't, Chairman. Sorry, I was struggling to find my mouse underneath all the papers. We didn't change it, did we?
No, I don't think so. Jane, did we?
The only amendment came from the previous meeting when the dentistry update was requested at the April meeting.
That's right. Yeah, and that's gone on to the work plan. So I did check that has gone on. So we're happy with that. Sorry, I'm lost on iPads and everything here. So that we will leave as such. So then item 10 is any other urgent business. Does anyone have any other urgent business? Sorry, Jane.
Thank you, Chair. Really, just to say thank you to you for chairing, as this is your last meeting, and we'll have a new chair at the next meeting, but thank you for all your hard work. It's been an absolute pleasure.
Thank you so much, Jane. Thank you. So coming to the date and preview of our next meeting. So the next meeting is on Wednesday, the 26th of January at 7 p.m. It will be a joint meeting with Children and Young People Scrutiny because it is our beloved joint budget meeting for 22-23. Before I close, as Jane has just said, this is my final meeting, and it has been a real privilege to chair this committee. I would really like to thank the committee for all the hard work and support you've given me. And I'd also like to thank all the officers and all our health partners in health for all their support over the last 16 months. I am going to miss it. Of course, I will be attending because it is a great privilege to take over the portfolio. I will look forward to you being my critical friend over the next part as I'm the portfolio holder. Please be nice to me. But I would like to say, obviously, I take over on Monday morning. In the interim, as everyone knows, Councillor Waller will take over as the vice chair, will become the chair for the day, and then the chair will be voted in as by full council on Monday evening. But that being said, I will now close the meeting. It is 20:34. And so I will say good night to everyone. Thank you very much indeed. And we will see you all on Monday in person.
Thank you.
Good night all.
Good night.
Night.
Good night.